Hi everyone, this lecture is going to cover chapter 13 and we're going to be talking about gram-positive bacilli this time. We're going to compare and contrast some different forms of gram-positive bacilli, talk about some different pathogens and the diseases that they cause, describe specifically Clostridium pathogens and the diseases that they cause, and then finish up with a discussion regarding the role of pathogenic bacteria in bioterrorism. It's going to be a hoot. The invention of steam sterilization made one of these bacillus bacteria super famous, and we've already talked about it a little bit already, but that is Bacillus staurotheramophilus. And if this sounds familiar, that's because it is the spore that we use in the biological indicator when we run a steam sterilization load. And again, we've been talking about how these bacteria have these amazing abilities to adapt and overcome and survive. And Bacillus is a spore-forming bacteria, and it loves the heat, and so it's perfect for us to test our steam sterilization methods with. So we have a famous bacillus among us today. As we have discussed previously, bacilli are rod-shaped bacteria. They are typically gram-positive, but sometimes can stain gram-negative, and so a few of those are referred to as gram-variable. Most species are catalase positive, and remember what that means is that these bacteria have a defense mechanism that allows them to break down hydrogen peroxide. They are also saprophytes, and so that means that they use dead or decaying material to get their food and get their nutrients. Some of them prefer to live in an aerobic environment, where others don't really care so much. So they're classified as either aerobic or facultative anaerobes, and they are quite motile. They have flagella and can move about the country, and there are some varying ideas of how many bacilli species there are out there, as little as 40, as many as 295. But there's only a couple that are really pathogenic to us, which is Bacillus anthracis and B. cereus. Okay, anyways. And then for the use in scientific research and the sterilization process, we look at B. subtilis and the Bacillus staurotheramophilus, but those are not pathogenic to us. They don't harm us at all. And then they're also helpful in the production of antibiotics like bacitracin and polymyxin, which is the B. subtilis, and the B. polymixa. They are also able to form spores. And when they are in an environment that has adverse conditions, they form their spores, and then when the environment returns to a more inhabitable condition, then they revert back to their vegetative state, where they begin reproducing and growing in colonies. Bacillus anthracis was discovered by Robert Koch, and he grew the bacteria in a laboratory culture in 1877, way back when. The bacteria can appear as either single or paired. So Bacillus diplobacillus, or as long chain Streptobacillus. And the thing about anthracis, the bacteria that causes anthrax, is it has some unique survival mechanisms. And one is that it has a capsule, and this capsule protects it against engulfment by host phagocytes, and then it secretes a toxin. Now, the capsule is most important during the early course of the infection, but the toxin is the dominant disease factor, and the three components of the toxin aren't really harmful apart from each other, but together it makes it lethal. And those three components are, there's a protective antigen that induces protective antitoxic antibodies. The second thing is the edema factor. And the third thing is a lethal factor, which contributes to the death of the host by oxygen depletion, which can lead to shock, respiratory or cardiac failure, and increased vascular permeability. Direct exposure is typically the way that humans contract anthrax. They can get the disease through inhalation, ingestion, or inoculation. It also likes to hide in animal products. No hide nor hair is safe from anthrax. Also, the spores like to live in the dirt. And so inhalation is a common way of getting anthrax. A long time ago, it was referred to as wool sorter's disease. And this is because there was an outbreak when individuals that were processing the hair of infected goats and sheep became infected with anthrax. It's really rare in person-to-person contact, so quarantine precautions really aren't necessary. However, if there are open wounds or something like that, we want to be careful of that. It's commonly found in Central and South America, Sub-Saharan Africa, Central and Southwestern Asia, Southern and Eastern Europe, and in some islands of the Caribbean, but in the United States, it's pretty rare. There are 4 ways that anthrax can gain entrance into the human body, and that's through the skin, through inhalation, through the digestive tract, and through injection. There's a high number of individuals that become infected through the cutaneous route when they are working or handling animals or the hides and hairs of animals. And when this happens, it begins as just a small little puncture, and then over the course of about a week can become an ulcer up to about 3 centimeters. It's rarely fatal and can be treated with antibiotics. Now, inhalation of anthrax, again, can be contracted by workers that are working in wool processing plants, slaughterhouses, and animal tanneries. And what happens is they breathe in the spores of the Bacillus anthracis, and then it enters their respiratory tract, moves into the lymph nodes, rapidly multiplies, and then spreads throughout the rest of the body via the lymphatic system. And this is the most lethal type of anthrax, and it can have an incubation period up to 2 months long, but it does lead to respiratory failure and systemic shock, and it has a really high mortality rate of 45%. Without proper treatment, and that's with treatment, without proper treatment, a maximum of 15% of infected individuals will survive. Now, the GI tract is another way that individuals could ingest the bacteria, and this is through undercooked or uncooked meat. And then the bacteria penetrates the mucosal tissue, and it gets into the bloodstream that way. And we rarely see this in the United States, but it has a 60% survival rate with treatment and about a 50% survival rate without treatment. And then the last one is injection, which hasn't been documented in the United States, but in some other countries, IV drug users have been known to transfer those bacterial spores through infected needles. Now let's talk about the diagnosis and treatment. As far as diagnosis, we're going to take a culture and we're going to look at it under the microscope, and that's how we're going to diagnose it. If we're going to put it on a plate, it is non-hemolytic and it is going to multiply very rapidly, and it's probably going to appear in chains and have a sticky appearance, and it does not have motility. So it's one of the bacillus that do not have any flagella. As far as treatment goes, we can treat with antibiotics, and there's two common ones, ciprofloxacin and doxycycline. Prevention. Prevention methods include controlling the disease among animals, and this is why we don't see a lot of anthrax in the United States, is because we have strict policies about vaccinating our animals here. Some individuals that are at higher risk are laboratory workers, veterinarians, and members of the U.S. Armed Forces. There is a vaccination that they have created to treat anthrax, but it hasn't been given to anyone. They would only give this vaccine if there was some sort of bioterrorism incident, and then those that were exposed would receive a series of 3 injections for over a 4-week period of time, and then some oral antibiotics as well. The spores of anthrax can be killed with steam or gas sterilization, so that's good news. They can also be killed by boiling them for approximately 30 minutes. In the vegetative state, they're a little bit easier to kill, and we can kill them with a diluted bleach solution. If you remember, in 2001, anthrax was actually used as a biological weapon, and it was used in the form of powder that was put into letters that were mailed to individuals in Congress and the television media. And it ended up that 22 people, including 12 male people, were infected with anthrax, and 5 people died from their infection. So the CDC indicates that anthrax is a good choice for a biological weapon, which is something that we should really put out there. It's a good choice because it's difficult to detect. It can be put in powder, sprays, food, water. It can also be produced in the lab. It can live for a really long time in very harsh environments because it does have a spore. Other things that makes it a good choice for a biological weapon is that it can be released discreetly and could also be released into the air, and that inhalation anthrax, remember, is the most deadly form. So as far as being prepared for something like that, the CDC recommends that we shouldn't panic, that we should have some sort of emergency kit prepared and kind of stowed away in the event that there is some sort of emergency, be it bioterrorism or something else. And in there, we want to have stashed away our medical history, medications that we take, allergies that we have, along with some other items that the CDC recommends, and to be cognizant of the signs and symptoms, which would include fever, chill, diaphoresis, shortness of breath, chest pain, headache, nausea, vomiting, exhaustion, and body aches. It's time for us to get serious and talk about Bacillus cereus. No, really. So Bacillus cereus, seriously, it is an opportunistic pathogen, and it is responsible for causing eye infections, as well as it likes to attach itself to IV catheters. It can also be ingested and cause GI issues as well. It is blamed for a majority of food poisoning cases, and it can be transferred in contaminated food, and because it can make a spore, it's more difficult to kill it with just the normal heating of food. As far as ocular infections, there's two ways that this occurs. One is an external, results from external trauma of the eye, and this is referred to as exogenous. And then there's also an endogenous infection that can occur from bacteria entering into the circulatory system, then into the posterior chamber of the eye. Sadly, 70% of these cases reported due to Bacillus cereus results in a total loss of vision due to enucleation. That means they have to have their eye surgically removed, or evisceration, which is a rupture of the infected eye. In addition to that, other infections that can be caused by B. cereus are those of the central nervous system, and this is due to the placement of ventriculoperitoneal shunts for the treatment of hydrocephalus. It can also live along those ventriculo arterial catheters as well. So those are used to treat endocarditis. There are 6 different species of Listeria that have been identified, but only 2 of those cause disease in humans, and those are L. monocytogenes and L. ivanovii. And they don't form a spore. They are motile at room temperature, so they have flagella, and they can take up residence in domesticated animals, birds, and humans, and use them as their reservoirs. While it's relatively uncommon for the organism to cause disease in humans, again, our elderly, our pregnant females, and our immunocompromised individuals are going to be those that are of the highest risk for getting an infection due to Listeria. Listeria monocytogenes is responsible for causing food poisoning, or something called listeriosis. It's the 3rd leading cause of death from food poisoning. In the United States, according to the CDC, 1,600 individuals-ish are infected with Listeria each year, and approximately 260 of those individuals die. Now, the ones that are at the highest risk, again, are our immunocompromised patients, pregnant females, and the elderly populations. In fact, after the age of 65, fatal complications from the illness skyrocket up to about 58%. Listeria can also cause meningitis in individuals that have had organ transplants, patients with cancer, or pregnant women. Again, those that are immunocompromised are at a higher risk. Pregnant women, in fact, account for 14% of all cases, and they're 10 times more likely to become infected with Listeria than the general public. And this could lead to miscarriage, stillbirths, and it can also cross the placental barrier. So in that regard, there's a late onset form of listeriosis that can be transferred to the fetus, and then a couple weeks after the baby is born, it can develop meningitis or meningoencephalitis with septicemia as a result. There have been several outbreaks with Listeria monocytogenes. They tend to peak in the warmer months, but some of the ones that the book lists are those associated with contaminated vegetables or contaminated soybeans, cheeses, soft cheeses mostly, and some of those are in the United States, like in California there was an outbreak, in Illinois there was an outbreak. There was also have been outbreaks in Italy as well. And so some things that we can do to prevent the spread of listeriosis is making sure that we wash all of our fruits and vegetables before we eat them, even after we take their peels off. We should be washing them according to the CDC. It's also good not to store cooked foods in the same place that you're storing uncooked foods, cooked meat with uncooked meat, that kind of thing. Making sure that we do routine cleanings of our refrigerators, and when we're cooking meat, making sure that we're cooking it properly so that we can make sure that we're killing those bacteria. The book also suggests things like avoiding processed deli meat and store prepared deli salads. Also, we shouldn't eat hot dogs or pre-cooked sausages that haven't been heated properly. Also, soft cheeses that have been made with pasteurized milk. There's some like queso fresco and certain refrigerated smoked seafoods and canned seafoods that could also harbor the bacteria. So the way that we treat listeriosis is with antibiotics. Unfortunately, there isn't a vaccine available. Lactobacillus. Lactobacillus gets its name because it is a lactic acid producing type of bacteria, and it is considered a facultative anaerobe. Now, it can grow where there's oxygen, but it doesn't grow as well. So it prefers an environment where there is no oxygen whatsoever. It is gram-positive. It does not form a spore, and its lactic acid production has been known to spoil food. However, we can use it to our advantage when we make things like pickles and sauerkraut and yogurt. Now, lactobacillus is part of the normal microbiome of the vagina, and studies have shown that just a few short weeks after birth, the female infant's vagina is also colonized by lactobacillus. There was a doctor by the name of Martin Blazer, and he determined that one of the reasons that is really important for the baby to pass through the vaginal canal is because it gets exposed to mom's lactobacillus colonies in the vagina, and this becomes that first coating, that first microbiome of the baby. And something else he hypothesized is that when the baby would breastfeed, the lactobacillus would get onto the breast and then it would be ingested with the milk, which also helped to boost up its immune system. So he suggested that those babies that were born via C-section, that a gauze be placed directly into the mom's vagina, and then it could be swabbed onto the baby. There's also been some studies that suggest that because lactobacillus produce a toxin called bacteriocin, that could inhibit the virus that causes HIV, so the HIV virus. Again, lactobacillus is another example of a opportunistic bacteria where it doesn't typically cause us any harm, but if it's given the chance and we have a situation where there's immunocompromised patient or something like that, it has been known to be associated with endocarditis. Clostridium is a bacteria that is classified as anaerobic, gram-negative bacilli, and it does produce endospores. There have been about 100 species that have been discovered, and they've been found in places like the water, soil, sewage, and can even be a part of our indigenous flora of the gastrointestinal tract, and also of humans and animals as well. While most of them are harmless, there are some well-known offenders that are pathogenic to humans, and they can cause serious and often fatal diseases. And those are listed here for you. There are C. perfringens, C. novii, C. septicum, C. histolyticum, C. sordellii, C. botulinum, C. tetani, and C. difficile. You've probably heard of a couple of those, if not more. As we've discussed previously, Clostridium perfringens is responsible for causing gas gangrene. And this is a severe and life-threatening type of infection. Clostridium is non-motile, and it grows really rapidly in the lab. And it is so virulent because it produces many toxins, 4 of which are lethal and are referred to as alpha, beta, epsilon, and iota toxins. Clostridium perfringens is responsible for most human infections. It's found in the GI tract of humans and animals, in the soil, and also in the water that has been contaminated with feces that has Clostridium in it. Now, alpha toxin, quite a few of these toxins actually increase vascular permeability. Alpha toxin does, epsilon toxin, and iota toxin all increase vascular permeability, which leads to increased bleeding, hemolysis, bradycardia, hypotension. Beta toxin is responsible for necrosis in the small intestine as well as hypertension. So some symptoms that we might see is fever, pain, swelling, increased heart rate, vomiting, pale skin, and blisters with a foul-smelling discharge. Clostridium perfringens and septicum can also cause cellulitis in the deep tissue, as well as fasciitis, which is the inflammation of that fascial layer. It's called gas gangrene because the metabolic activity of the bacteria produces gas within the tissues. It's also responsible for foodborne diseases and necrotizing enteritis, which can also cause abdominal pain, bloody diarrhea, shock, and peritonitis. Clostridium botulinum is an anaerobic bacteria, and it's divided into 4 basic groups, 1, 2, 3, and 4, based on the toxin that it produced. Now, strains of type 1 and 2 are the most common cause of human diseases. And toxins A, B, E, and F are the ones that are associated with human infections. And Clostridium botulinum is found worldwide. It is found in the soil, and the outbreaks in the United States, thankfully, are uncommon and fairly rare. How the toxins produced by Clostridium botulinum work is they block the release of that neurotransmitter acetylcholine into the neuromuscular junction. And so in this way, they paralyze muscles. There are 5 types of botulism that the book talks about: foodborne, wound, infant, adult intestinal toxemia, and iatrogenic. Remember, iatrogenic has to do with an illness that's caused by a medical treatment or a health care provider. Foodborne botulism is rare, but it's really serious, and that can cause abdominal cramping, It can affect the eyes as well. The mouth can be dry. Speech can be slurred. Can also lead to paralysis of the diaphragm and ultimately cessation of breathing. There is no fever associated with food-borne botulism, and it is not spread from person to person. Proper handling of food is how we can prevent infection, properly heating food and examining canned food to make sure there isn't any signs of contamination like leaking, bulging, rusting, badly dented cans, cracked jars, jars with loose or bulging lids, or if it smells bad. That's just right up front a reason not to eat it. Wound botulism, again, is rare. And then there is infant botulism, which was first described in 1976 and is considered the most common here in the United States. Infants that are infected with C. botulinum typically get it from eating contaminated foods, or it can be ingested because it can live on various surfaces, so they could get it that way. So we would want to avoid giving them food that's contaminated and limiting the contaminated surfaces that they're touching. Historically, honey and butter have also been identified as methods of transmission, and the CDC suggests that you shouldn't give anybody under 1 year old honey. So the symptoms that we might see, droopy eyes, weak cry, poor sucking reflex, constipation, lethargy, and flaccidness. This is also referred to as floppy baby syndrome. And then lastly, iatrogenic botulism is caused by doses higher than recommended of Botox injections. Clostridium tetani is widespread. It is found in the soil and it colonizes in the GI tracts of humans and animals as well, and it does form a spore. It's pretty rare now in the United States since the development of the Tdap vaccination. Now, the bacteria Clostridium tetani produces two toxins, one that is a neurotoxin and one that is a hemolysin, and it acts by blocking neurotransmitters and inhibiting synapses at the neuromuscular junction. Incubation periods for tetanus are approximately 3 to 21 days, with 10 days being about the average, and it attacks the central nervous system. Two common signs of tetanus are trismus, which is lockjaw, and opisthetonos, which is that arching back with the heels pulled back. That is classic of tetanus. You see those pictures a lot. It can also be characterized by profuse sweating and then an alternation between increase in blood pressure and drop in blood pressure, and also cardiac arrhythmias. And fatality is about 10 to 20%. A less severe form is called localized tetanus, and the rarest and most life-threatening form is cephalic tetanus, which attacks the head and the face, and has also been connected with otitis media infections. So how do we treat it? How do we prevent it? Well, the way that we treat it is by going to the hospital first and foremost, and the individual is going to get some injections of the tetanus immunoglobulin, a tetanus booster as far as the vaccine, and some antispasm medications. They're also going to give a dose of a tetanus antitoxin. And as I mentioned, there is a vaccine for tetanus. Tdap, we're required to get it before we go to clinicals. And about every 10 years, they suggest that we get a booster so that we can maintain our immunity. Clostridium difficile, or C. diff, as you might have heard it called before, is a gram-positive anaerobic spore-forming bacillus bacteria. It is closely associated with outbreaks in the healthcare setting, and it was named C. difficile in the 1930s because scientists in the lab had a really difficult time isolating it. So where can we find it? We can find it in the soil, and it is also found living in the human gastrointestinal tract. It is an opportunistic pathogen, and it has a few virulence factors that make it difficult to treat. One is it's resistant to heat, and it's resistant to stomach acids. It also secretes toxins in the intestinal tract that can damage the colon and cause severe, long-lasting diarrheal disease. Many individuals that become infected with C. diff have a history of long-term antibiotic use. So what this does is it kills off the normal gut flora, and because C. diff is so resistant and it doesn't have to compete with the normal gut flora because it's gone, it grows out of control and it kind of takes over. It can be transmitted person to person. It can be shed in feces. It can live on inanimate surfaces for a long period of time. And it can also be ingested, and you can get an infection that way. Symptoms include fever, abdominal pain and tenderness, nausea, loss of appetite, and diarrhea. These individuals are at a high risk for dehydration, and some even undergo colon resections to remove that infected and or necrotic portion of the intestine. The way that we prevent this is by discontinuing antibiotics for other infections, and then they're going to continue to increase the strength of the antibiotics that they're giving, but unfortunately, this just continues to kill off the normal flora and allow C. diff to proliferate. Some experimentation has been going on with fecal transplantation. And so this is where they will take feces of a healthy individual and they will insert it into the person that's infected with C. diff in the hopes that it will repopulate that normal gut flora and reduce and retard the growth of the C. diff. Best ways to not get C. diff is by washing our hands, practicing aseptic technique so that we can prevent cross-contamination between patients. Also, doctors shouldn't go crazy prescribing antibiotics before they know what bacteria or microbe they're trying to fight. This is going to increase antibiotic resistance, and it's also going to continue to decrease the normal flora inside the body. In addition to that, if we are prescribed antibiotics for something, we need to make sure that we take the whole course and not just take the antibiotic until we feel better. This concludes our overview of gram-positive bacilli.